Morning, this is Daniel Rodriguez, your daily coronavirus update. So let's go over the prevalence. That's the number of active cases divided by the population times 100,000 to give it context. Luxembourg is the worst, followed by Switzerland, Spain, and Italy. They're all over 100 people per 100,000 population. For the United States, we're about 41 right now, 41 per 100,000. So glad these other countries are just so far down, doesn't even matter anymore. China, 0.2 times per 100,000. So these are things we'll look at in a second. Changes from yesterday. Luxembourg, we have this increase of 18 per 100,000 since yesterday. United States, we're about 5 per 100,000 since yesterday. In terms of case fatalities, I'm going to check. We'll be looking at those in a moment. But you can see that for South Korea, there's a decline per 100,000. Taiwan and China, so whatever they're doing it well over there. Let's look at these figures here. Let's start with looking at the United States. So this is how we've increased in individuals per 100,000 since March 12th. As you may, if you're following me, you know that's when I started collecting the data on this. So if we look at this figure here, this is the United States, Italy, and South Korea. Again, I picked South Korea to compare with the US because we had the identification of the first case at the same time. So they've actually done a good job in decline. Keep in mind, though, when we do prevalence, it depends on testing. So this may not be that we're getting new cases every day, like people are getting infected every day. Instead, we're detecting them every day. So these lines may be prevalence. Either you could look at them as prevalence of the disease or prevalence of tested, confirmed over time. But we're trailing Italy. Italy keeps on rising, as does the United States, but we're way below them in terms of prevalence per 100,000. So this is the figure I've been presenting, looking at the relation between case fatality. Those are people who are infected who end up dying. So it's a probability of dying if you have the disease. Again, this might differ depending on age of the population, so let's take a look at that. So this is the proportion of the population that's 65 or above by these different countries, and I sorted the data by case fatality, where we get the highest to the left and the lowest to the right. You can see the discrepancy here between the age proportion of the population above 65, and this is the hospital beds per 1,000 individuals. These data were collected, these are available at the World Bank, and they're from a variety of different years whenever the data are available. So they definitely precede what's going on here. So in a sense, that's predictive in a way, right? So you have temporal precedence, and then this is the density of individuals in a country. That's number of people per square kilometer. And what I did was I divided them into these different, into this quartiles. Well, not quartiles, actually, I shouldn't say that. I divided them based on this system, ordinal system. And countries that have less than 100 or 0, 1 to 200 or 1, 2 to 200 or 3, 300 and above are labeled. Wait, I mean, 0 is for 0 to 100, 1 is for 100 to 200, 2 is for 200 above, 3 is for 300 and above, right? So that this is the densities, but you can see right here that still in Italy and Spain, where you have the highest proportion, this high proportion of individuals above 64 and a low number of hospital beds per 1,000, you see the greatest number of case fatalities. So here in Japan, you have a large population above 64, but you also have a large number of hospital beds, and you also have a decrease in death. So it looks like public health needs to focus on providing enough hospital beds for everybody, especially when you have older population. So here, these are the data I use. This is hospital beds per 1,000, and this is the proportion above 64, and this is case fatality, and these are the actual densities and how I created that ordinal variable. So we'll look at a few cases here. We have hospital beds. Proportion above 65 is very high in Italy and Spain, and I'm looking at the best hospital beds per 1,000 in Japan and South Korea. Just so happens that you have lower case fatalities in those countries, 2.89 in Japan and 0.61 per 100,000 in South Korea. So just some stuff to keep in mind. These are also population densities, so what they translate to. So some countries are doing a better job than others. This is Daniel Rodriguez. Thank you for watching. watching today. This was your daily coronavirus update.